Well, everyone, my name is Dr. Chantel. I will bring it to you on management of ankle and foot pain from amazing physiotherapy. Okay, my way of overview. Like the way a properly designed foundation is critical to the structure of the styrofoam. The alignment of the human body, called the vertical geometry, is dependent upon its foundation, known as the feet. The feet is actually the lower part of the body. The problem of ankle and foot could be one of the frequent causes of pain and disability in those whose work requires prolonged standing, walking, or running as a result of their profession. Most of the problem could be due to improper shoe wears, postural trauma, and also it could be as a result of overuse. As a general rule, the ankle and foot problem respond well to conservative management, including physiotherapy. A lot of introduction. The feet and ankle plays a crucial role in the supporting our body, facilitating movement and maintaining balance. However, they are susceptible to a wide range of injuries and conditions that can cause discomfort and affect our daily activities. All right, let's go to the anatomy of the foot and ankle. The foot is made up of a bone, different kinds of bone. You call it the tarsal bones. The tarsal bone, it includes the talus, the navicular bone, the calcaneal bone, the subtalar bone, the cuboid. And also we have the joint, we have the mid-tarsal joint, which is responsible for plantarflexion and dorsiflexion of the foot. Also, we have the subtalar joint as well. So there could also be what we call Potter's fracture, when any of the bone of the foot, especially the talocrural joint, is fractured. It could result in Potter's fracture. Okay? Understanding of the anatomy of the ankle and foot is crucial for the diagnosis and treatment of pain and injuries in these areas. Any destruction or damage to the bones, the ligament, the muscles, the nerves, the blood vessels could result in ankle and foot pain, affecting mobility and quality of life of an individual. The ankle is made up of the bone. In this bone, it's formed by 3 bones actually. We have the tibial bone or the shin bone. We have the fibular bone, which is the outer bone of the lower leg, and also they have the bone that sits on top of the heel of the foot. The foot consists of bones, including the tarsal bones that I've mentioned, forming the hind foot, the rear foot, and then the mid foot. And also we have the metatarsal bones, forming the forefoot and the phalangeal toes. The ligaments, which is very crucial to the supporting of the joints, is a fibrous tissue that connects bone to bone. It provides stability to the joint. Sometimes people will come in with ankle sprain. You notice that there's a tear of the ligament or there's an injury to the ligament. In the ankle, important ligament includes the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. The ligament in the foot helps support the arc and stabilizes the joint during movement. Okay, we also have muscles which also plays a role in the foot. The muscles in the lower leg and foot contribute to the movement and stability of the foot too. The key muscles include the gastrocnemius muscle, that's the muscle here, the soleus muscles too, which helps the plantar flexion, that's pointing the foot downward, and also the tibialis anterior muscle, which is responsible for dorsiflexion, that's pointing the foot upward. Tendons, which are also very important, is a tough band of tissue that connects muscles to bone. In the ankle, the Achilles tendon connects the calf connects the calf muscle to the heel bone and is essential for walking, running, and jumping. Other tendons in the foot can help play a role in movement of the toes and also support the vessels. Also have nerve and blood vessels of the foot. They help to supply nutrients and sensation to the tissue as well. Important nerves include the tibial nerve, this nerve innervates the soleus muscles of the foot. Also have the peroneal nerve, which contributes to movement and sensation on the outer part of the foot as well. Epidemiology of the foot. It affects people of all ages. Foot and ankle pain actually affect people of all ages and activity level. Though it can vary between countries due to its demographic, lifestyles, healthcare system, and environmental factors. For example, in the developing countries with aging population, conditions like arthritis, neuropathy may be more prevalent. In countries with high rate of obesity, there may be an increased incidence of foot pain related to overweight-bearing stress. Additionally, cultural practice and footwear choices can influence the prevalence of certain conditions like bunions, ingrowth of toenails. Access to healthcare and prevention measures also plays a role in shaping the epidemiology of the ankle and foot in different countries. There are some risk factors and also causes that could result in foot pain. And these are, all of them varies. So let's start with the causes. Causes can be an injury. For example, you are walking on a staircase, you twist your ankle. You might tend to have ankle sprain or ankle strain, depending. When it's ankle sprain, it means there is ligamental involvement. And when it's just a strain, that means that it's just a muscle involvement. And also there could be fracture, it could be Potter's fracture, and also trauma from incident or accident, and also could be as a result of sport activities. You can develop injury as a result of sport activity, high impact sports. Then you have also overuse injury, repetitive strain injury from activities like running, walking, standing for long periods of time, especially those that their job involves prolonged standing. Some of the engineers that go to sites, they come down with foot and ankle pain as well. Also, some medical conditions like arthritis, which includes rheumatoid arthritis, osteoarthritis, which is the wearing of the tissues. Tendinitis also could occur as a result of medical condition. You have plantar fasciitis. This one now, patient could tell that, I started having pain immediately I make the first few steps early in the morning that I wake up. It could be as a result of gout disease, neuropathy, flat foot. Some of us, you notice that if you check your foot doesn't have the arc on it. Instead, it goes down on the ground. It's more flatter. You don't have the arc which a foot should have. You can come in with a foot or ankle pain. Infection and bacteria such as fungal infection. When someone has fungal infection, the patient can come in with athletic foot, or you can call it cellulitis. Let's move over to risk factors. Risk factors include high sports participation. High impact sports or activities that involves repetitive motion can increase the risk of injury. Also, obesity. Most of us that have weight. The obesity, both male and female can be obese. It's not just specific for, but more in female than in male. So, excess weight puts added stress on the feet and an ankle, increasing the risk of the condition like plantar fasciitis or osteoarthritis. You know, so when a person is obese and you're having plantar fasciitis, that's inflammation of the plantar fascia. When you make the first step in the morning, you have pain, but when you start going about your daily activities, the pain disappears. Also, osteoarthritis is wearing away of the bones and the rest of them. Also, there could be improper footwear. Most of us, yes, you see people selling footwear. You say, I'd rather use one of this, use one, wash it, and go and spend money. But it's not good. At least try to change your footwear most times, because it also contributes. Some of us don't wear boots that are good. Some wear ill-footed shoes High heels or inadequate support can lead to foot and ankle sprain problems too. Some of us that are female will wear high heels before you know the person twists her ankle and then develop foot and ankle pain. Age also, other adults are more prone to arthritis and tendinitis due to natural wear and tear. Occupational factors like jobs that requires prolonged standing also could result to this. It's also a risk factor. Genetics, some family you will see that some of them have certain foot condition, like some people have a flat foot. In some families, some people have curved foot too. So problem, and we have also biomechanics for poor biomechanics. Flat foot, high arcs or abnormal gait pattern can strain the foot and ankle. Previous injury, maybe you had a previous injury of ankle sprain, you did not treat it properly, and again you are not trying to avoid the pain, and so that you don't put your weight on it. You see that the muscle starts becoming weak. Before you know it again, you sprain the same ankle again. You also have medical conditions like diabetic peripheral artery disease and other systemic diseases can also affect the health and also increase the risk of complication. So, in general, there are different kinds of foot and ankle injury we have. We have the plantar fasciitis, like I've talked about it before. We notice that when you make the first 2 steps in the morning, you start having pain, and the pain is very very bad that you can't even walk again. Then most of us that don't wear slippers at home you have a tendency of developing this ankle plantar fasciitis. And again, there is also inflammation of the plantar fascia when someone tends to have this plantar fasciitis. Again, you have ankle sprain. It's common too among the young ones and then also older ones too. When you notice you wear high heels for female, before you know it, to twist your ankle, or that could be weakness of the ankle muscles too. You twist your ankle too. You also have ankle sprain. This one, you have the muscle that ankle sprain, the ligament have been strained. Then you have ankle sprain, the muscle that has been involved. Then there's also potass fracture. There could be fracture of the ankle joints. Yes. Maybe you are trying to hold yourself, before you know it, you've already twisted and the tarsal bone is now fractured. All right. Also have other foot deformity that could lead to ankle pain, such as pes planus and pes calvis. Pes planus, which is flat foot, and pes calvis, which is curved foot. They can result in foot and ankle pain as well. When a patient is having pes calvis and pes planus, which is flat foot, how do you treat it? Because I've seen some patients come in and say, "Oh, doc, I have pes planus." When you assess the patient, you see that you have to start doing physiotherapy treatment, then also make use of orthotic devices. So let's move on to physiotherapy management of ankle and foot pain. How do you manage this? All right, firstly, a patient walks into your clinic. How do I manage this patient? After the patient must have given you the history and everything, you make your assessment and diagnose. All right, first, patient complains having pain. In the physical examination, you have to check the range of motion of the patient. You have to check the strength assessment, and also, if possible, imaging, demand for X-ray or MRI if there is need. Okay, in pain management, initially the focus may be on reducing the pain and inflammation first, especially for those that have ankle sprain, because when there is grade 4 or grade 3 ankle sprain, I don't think even you as a physiotherapist would like to do anything to it. First, you have to manage the pain, because the patient will not even allow you to touch the ankle because of it's very painful and there is serious inflammation on it, especially for grade 3 and grade 4. Don't even talk about the grade 5. All right. The focus may be on reducing the pain. How do you reduce the pain when a patient wants it? When a patient wants it to you, for acute management of this, there's first 3 weeks in acute management. How do you make use of RICE protocol? Yes, you have to rest the foot. Use ice, that's what we call cryotherapy, physiotherapy. Make use of cryotherapy to manage the inflammation. You make use of compression, then try to elevate the foot so that you drain to the nearest lymph node of the foot. Then, when it's becoming subacute, we can call it, You can make use of heat, ultrasound, and again, I know there will be an electrical stimulation because the muscle might be weak, and you said you don't even know that must be the cause of your ankle sprain. Yeah. Then again, try to restoration of function and range of motion. Exercise and manual therapy technique are used to improve flexibility and restore normal range of motion to the ankle and foot joint. This may include stretches. I'll demonstrate it once I'm done. This may include stretches, exercises for the calf muscles, ankle, foot, and as well joint mobility exercises as well. Exercise prescription is tailored to strengthen the muscles as well, improve stability, and also support the joint as well. Lastly, also you have to correct the imbalance contributing to the pain too. And this may include exercises like calf raise. There's a calf raise, there's a toe pull, there's a resistance band exercises. Enhancement techniques like massage, joint mobilization, stretches can help improve the stability, reduce muscle tension, and restore normal joint motion. Gait analysis. When a patient has foot and ankle pain, from the gait walking pattern, you will know patient comes in with attached gait in your clinic. You should know that it has to do with the foot, or it can have to do with any other joint apart from the foot. Okay, analyzing walking and running pattern can identify any abnormality that may be a cause or exacerbating the pain. Corrective strategies such as orthotic and gait retraining may be recommended as well. Also, you have to educate the patient on proper footwear and activity modification and strategies for preventing further future injuries. Also, learn self-management techniques for pain relief and injury prevention as well. Functional training, specific exercise and activity relevant to the patient's daily life or sport activity will be incorporated to ensure a successful return to normal function. So, we have also balance and proprioception training. Exercise helps improve joint stability and reduce the risk of future risk of injury. All right, biomechanic assessment, addressing the underlying biomechanic issues such as overpronation or supination can help alleviate stress on the ankle and foot structures. You will notice that, okay, there is what we call foot drop. When patients go for injection, some of them come back and say, I went for malaria injection. Just watch the person, some of them. That means they will be complaining of pain. Then after 1 week, you see that the patient is having foot drop already. That means they've already damaged the patient's sciatic nerve. So it's also foot issue. It matters. It's a challenge already. If you don't treat it immediately, it can cause disability to the patient. And this thing happens mostly in our younger ones, our children. When they go for injection, before you know it, your child start walking in a different gait pattern, which he was not adapting before. All right. The orthotic devices or footwear recommendation may be provided to improve alignment and support. So let's go into our exercises. How do we improve this patient's stability, function, and increase the patient range of motion for a better functional movement? All right, that's what we call a toe stretch. Okay, let me give this. That's what we call a toe stretch. This is my ankle and foot, which I'm talking about. So patient can put the ankle and foot. This is the toe. They're trying to do this. This is a toe stretch. It will help to stretch the muscle, also increase range of motion, provide stability, and also relieve pain. They also you can make use of this also. It's a massage ball. Use it to relax the muscles of the foot. Use it, it gives you the sensation that is cool. And also, you can also use a TheraBand for strengthening exercises. All right. If you want to do a dorsiflexion strengthening exercises, for example, this is how I'm holding my, you can make use of a TheraBand, or you can call it a resistance band. All right, you put it this way. It does a flex. And then dorsiflexion, you put a resistance to it, dorsiflex. Also, the other way around, you can do plantar flexion exercises to plantar flex. Plantar flex. And as you are doing this, you're also improving joint range of motion and also strengthening the muscles as well. There's also the one we call static and dynamic exercises. Patients put a table to support herself, then try to raise the leg and then this stretch it. Okay. All right. Again, you have standing calf stretch. You have to stand on the wall. It's quite a whole lot of exercise to stretch the calf. You can do it to the opposite leg too. Try to stretch the calf. Stretch the calf. Then you have step up. Make use of a stepper. Make use of a stepper to step up. When you step, the other leg is on the ground, then you step down, then step with the other leg. We have a lot of exercises for the foot. Also, that what we call resistance inversion and eversion for the foot. You're trying to invert, you're putting a resistance. You're trying to invert, you're putting a resistance. It helps to mobilize the joints, improve joint range of motion. All right. Some people have, when you come to plantar fasciitis, for people that have plantar fasciitis, it's very important because that pain is usually very, very painful from some patients that come across actually. You can use sitting plantar flexion. You want to stretch the plantar fascia because it's the plantar fascia that is actually inflamed. So you try to sit, put your leg across the other one, then try to stretch. Stretch, put a stretch on your toes. You feel a stretch on this plantar fascia. Also, we have towel stretch. You can use a towel to put a stretch. This. Try to stretch, stretch, return back, stretch. You can use a resistance band for it. You can also use a towel for it. Then you have what we call frozen core row. This frozen core row, you sit. Let me say I'm seated this way. Just do as if you are freezing this ball. Put in your strength there, then try to roll. Try to roll it. That's what we call frozen core roll. It's very good. Okay. There are more exercises. We have plantar fascia stretch. That one also use a stepper. You step on the stepper, if there is a stepper, then you step on the stepper, then try to use your toe. Step on the stepper, then raise your calf this way. This way. So just bring in your questions and I'm here to answer you. Thank you very much. Thank you very much. Thank you very much. We've come to the end of our presentation. So I want to get your questions from different places. Oh, thank you. I can see my sister. She don't. You're welcome. So send in your question and I'm here to answer your questions. Send your questions. Let's take it down one by one. Send me your questions. Ask also from the audience, you can ask to bring in your question. Okay, someone sent in a question from Lagos. You were like, okay, my name is Ademola from Lagos State. I had an ankle sprain 3 weeks ago. I've been able to manage the swelling, but still having the pain. Okay, Ademola from Lagos. Yeah, that means you've already managed the swelling, but there is still an injury. That's why you're still having the pain. You can always reach out to any of our branches in Lagos. They will attend to you properly. Because if you've managed the pain, but you've not managed the major thing that is causing you the pain, maybe there's a soft tissue injury, maybe there's a ligamentous injury, the pain might still, the injury might still reoccur. Maybe you have weakness of the ankle muscles. So you have to go in, use any of our branch in Lagos, then you'll be properly attended to. And I'm sure the pain will be relieved. More questions. Okay, another person said, this is Stanley from Kaduna. He said, good morning. I had a fracture of the ankle. Maybe he had a Potter's fracture, we don't know. So he said, but I had a surgery. Since then, my leg has been swelling after the surgery. Okay, Stanley from Kaduna, if you had a surgery and your leg develops swelling most times when you walk, that means you have to go for physiotherapy management. There, they can do the lymphatic drainage for you after the surgery, and also help to strengthen the muscle around your joints. Then drain the inflammation. Open up the nearest lymph node and drain it. I believe that the inflammation will go down. It won't come back again. But after the surgery, I meant to go for physiotherapy management. That means you've not gone for physiotherapy management, and that's why the swelling is there. So you have to go for your post-op rehabilitation. So you can reach to any of our customers. They will tell you where to come in for assessment. Thank you very much, Stanley from Kaduna. Two questions from Instagram. The first person says, wonderful presentation, ma'am. I have a question. My friend has an ankle sprain for over a week now. We've been managing it properly, but it seems like the pain is not subsiding. What would be the reason? Okay, from Instagram. Say, what would be the reason that the ankle sprain she has not relieved? She's still having the pain currently. Okay, since it occurs, you are still in a better chances of managing it properly because it's still an acute case. Now, be managing it. Yes, I know some of us will do icing at home and rest, but coming for assessment will help you manage it properly. It's better you seek for the advice of an expert. When an expert manages it, is different from when you manage your pain. Come in, and I promise you will get a good relief. You will never have pain on that ankle again, because maybe you have serious ankle sprain that needs to be attended to properly, but it's not something you can self-manage. So come in and get a better treatment so it doesn't affect you in the future. Thank you very much, ma'am. All right, so the second one says, I have ankle sprain Then I continued to use it to play ball. Then it got to my left knee from right ankle. I started feeling pain on both legs, and I can't walk properly. Oh, that means your gait is already affected. Where is this one coming from? From Instagram. Okay, from Instagram. All right. The main thing is for you to manage your pain properly to enable you attain a good gait pattern, right? All right, so that means you have been managing it and still you're not getting any results. What do you think you should do? You should seek for the advice of an expert. When you self-manage and you know that you're not getting any results, seek for the advice of an expert. Come into the clinic so that we'll be able to attend to the cause of the pain, to know if there is a dislocation. It could be a dislocation, it could be a sprain, it could be a strain. We don't know until you come in for assessment. They will now know and tell you what you actually have. And also, I refer you for an X-ray. You go and do an X-ray and get to use it and treat you better. Thank you very much, ma'am. Okay, so the person is still typing and saying, but after I relaxed the leg, so you said you can't walk properly because I started feeling pain on both legs. So he said after I relaxed the leg for 1 year, I'm still counting. I see changes now back to the ankle where it all started from. Waiting for it to kick back. Waiting for it to kick back. What can I do? Come in for proper assessment. Then we also assess your footwear too, because if you are wearing infooted footwear, it could also be contributing to your pain as well. Yes, you also have to change your footwear when you come in for assessment and the rest of them. Thank you very much. More questions? Okay, this person said, Ihoma calling from Port Harcourt branch. She said, my mom wakes up with this pain early in the morning when she makes the first step in the morning. What do you think the problem is? She has gone for medical checkup, but still, after taking the painkiller, the pain is still there. What do you think is the problem? Okay, like I explained, from what I explained, thank you very much. I think you were listening to my presentation. That means your mom might be having a plantar fasciitis. So first, your mom should not be going around with barefoot inside the house. First, she should be wearing a slippers inside the house. Then bring her for assessment because it's something we need to manage, and also check her footwear. Because for me to be able to manage the plantar fasciitis, I'll have to use a modality to then also do manual therapy for her to be able for the pain to be able to relieve. And also, there's also what we call an insole that we use to support her footwear too, because some of them, when you see some of them also wear plantar fasciitis, which is as a result of inflammation of the plantar fascia, you see that some of the footwear they wear are hard. So we also use an orthotic device to support her footwear too. Then do the manual therapy that will also take her to the long run. She will never have that pain. Tell her to come in too. Next question. More questions, please. I'm here to attend to your questions one by one. Thank you all. More questions, more questions. More questions. Bring in your questions. Bring in your questions. More questions, please. Okay. Just drop in your questions. We'll see, attend to it at any time we see it. We attend to the questions at any time we see it. All right. Thank you all for watching. All right. I think someone wants to drop in a question. Okay.
All right, so we have another question from Instagram.
All right.
This one says, when you sprain your foot, should one use ice or heat? And when you walk a distance, why do you feel pain on that feet?
Okay, thank you very much, our viewers from Instagram. All right, when you sprain your foot, of course, definitely you're gonna feel pain because something has already happened to the foot. You twisted it, yes. First, when it's still in acute stage, that's first 3 weeks, you have to make use of cryotherapy, which is ice. What does it do? It relieves pain by causing vasoconstriction and numbing the nerve endings, and also reduces the pain through this. And again, when you walk, that means there might be a ligamentous injury that is causing you the pain, which has not, you might have a ligamentous tear, which is not properly taken care of. So you have to visit an expert so that the expert can properly manage it for you. Thank you very much. All right, just drop in your messages. We still attend to it anytime we come across it. We'll be coming to the end of our webinar today. My name still remains your doctor, your physiotherapist, Umano Chantel, aka Dental Ligaments. So, see you all next webinar. See you all in next webinar. Thank you very much for watching. Hello, my sis. I can see you. I'm watching from. You're welcome. You're welcome. You're welcome. Welcome. Thank you for joining us. This is Amazing Physio. Bye. See you all next time.